So, hi guys, it's Billy again. I didn't do a 5 month update, things have just been insane. So, I'm here now doing my 6 months post op top surgery update. And yes, it's gone really fast, which is quite bizarre because when I was wearing binders, it just dragged. So, yeah, you can see the results. Looking slightly more even now. Like I always say, I think it depends on what light you catch it in, or the angle or stuff. But sometimes I don't know, it could be worse. It could always be worse. So yeah, I'm not sure really what I'm gonna sort of talk about. Everything is pretty much the same as it's always been. I'm recently gaining more muscle. Not quite sure why, because I haven't done anything in the gym at all. So the testosterone must just be doing its job, really, I guess. Speaking in reference to lower surgery though, which some people call bottom surgery, I'm not really a fan of that. So my lower surgery should be coming up soon. I've got my pre-op appointment on the 30th of July, which is in 2 weeks, if that. I'm a little bit nervous. I'm joined to this group on Facebook, which is a UK based group, called What the Doctors Don't Tell You About Phalloplasty. So if you're based in the UK, I recommend you join this group, because even though in the group there's some horrible stuff in there, there's some images you don't really want to be seeing or that you might find distressing or disturbing, but it's all useful knowledge. It's all stuff that you're going to need to be knowing for when you go down this road. So I'm going to try and sort of post as much as I can, but I'm not sure how comfortable I am with taking photos of my genitalia post-op. So we'll see anyway when the time comes. But as it stands, I'm more than willing to talk to anyone about anything. But when it comes to photos of down there, I'm thinking, personally, this is something I'm going to want to keep private. A lot of you will be pleased to know. Someone actually asked me if I was going to be posting as many pictures on Facebook of that as I have of this. No, I won't be, don't worry. I'm not going to plaster your newsfeed. I definitely ain't getting banned from Facebook, so... yeah, so that's that. But I've got my pre-op on the 30th. It was meant to be on the 2nd, but they cancelled it, which apparently is really common. So again, if anyone's about to start this journey of lower surgery and blah blah blah, expect for your first appointment to be cancelled and rescheduled. I can't actually find someone at the minute that hasn't had theirs rescheduled, so chances are quite high. So anyhow, I'm hoping they don't reschedule the one that's in 2 weeks time, because I'm feeling quite nervous about it. Not quite sure why. I'm not sure what I'm feeling nervous about. I think it's because I've seen some like horrific images on this Facebook group of people getting infections or stitches popping and stuff like that. It's quite nerve-wracking. Not only that, but I'm actually quite scared. Before, when I was like building up to the days for my top surgery, I felt fine. I was just like, everything's fine, it's going to be amazing, everything's exciting. And then when I had it done, I didn't actually realise how emotionally difficult it was going to be, and it actually really surprised me. So yeah, basically I'm nervous about that. I'm nervous about being sick after I wake up, because of my phobia of being sick. A lot of people wake up and throw up, which I'm not really a fan of. So yeah, I'm trying not to think about it too much. Loads of people have been sending me like comforting messages and stuff saying it's going to be okay. I guess we won't know until the time comes. But fingers crossed, it all goes well, hopefully. So yeah, back on to this. I'm not really sure what to say. I'm starting to get pecs, I think. There's a bit of a bump there now. But this nipple's actually finally come through. You couldn't see it for ages before. And I recently got tanned, even though I look white on this. But yeah, I went to the beach, I went topless. You could sort of see my white bits there. Can't really see it as clear on camera. Strange. Yeah, and when my chest tanned, it basically blended in, like the scarring and stuff, even though this one happened to stand out a bit more. But I'm not really too bothered by that. I think overall it looks okay. So, yeah. Other news. Oh, big news. So I've been on testosterone just over 2.5 years now. And in that whole time, I've never grown a moustache. Ever. I've got facial hair everywhere, and it's starting to come up further as well. which is great. But I had a shot about 3 weeks ago, but the shot before that, I put up a Facebook status saying I hope I get a moustache with this one, and I actually started growing one, which is weird. So yeah, I started growing one. I had a shot then a couple of weeks ago, and now it's coming through thicker, but it's still really, really thin. Some guys get the moustache first. I don't. Well, 2.5 years later, I still can't bloody grow one, but it's starting to come through. I'm not sure if you can see it on the camera. Maybe. Yeah, just about. But yeah, you can see all my facial hair here. There's just loads of it. And it's starting to come up my face now, as you can see here. Yeah, obviously still getting spots and stuff. That's going to happen for a little while longer yet. But all in all, I just can't wait to get a full thing. I think the moustache makes all the difference. I think when you see someone with a moustache and it sort of just completes the facial look, because at the minute it just sort of goes under my chin. So when you look at me dead on, you can normally, especially when I shave this away, you can normally not really see anything, even though it's here. It's just not quite within frontal sight. Anyway, enough about that. People probably think I'm a bit weird. Another thing for UK based, where's my letter gone? UK based FTMs. I just tore apart my home room for that. So, okay, so I had a letter sent out to me, which most of you think it looks familiar, for an appointment on the 15th of July, which is Tuesday coming. Today is Friday. And it was to see Dr. Andrew Davis, who I've actually never heard of before. Then it was to see the clinical nurse afterwards, which we all know is a 5-minute appointment where they weigh you, measure your height, ask you how things are going, ask you your sex drive is, blah blah blah. That's fine. They've rescheduled that 5-minute appointment. So yeah, this one here. They've rescheduled it for the 8th of August. 5 minutes. I live 210 miles away from the hospital, and they want me to drive 210 miles for a 5-minute appointment so they can weigh me and ask me how I'm doing. I've rung Charing Cross 183 times across 2 days, left multiple voice messages, and they've not got back to me. I did post in one of the FTM groups on Facebook, and someone said they've changed their number, but I was ringing the number written on this letter that was sent out to me last week, so if they've changed their number, I would have imagined they would have updated it there. Either way, I'm not going. Years ago, I would have said, yep, I'll do anything to get to Charing Cross because this means so much to me. But sorry, it is absurd that they should expect someone to travel across the country for 5 minutes for something that they could probably do over the phone. It's stupid when they've done it to me a couple of times when they moved the clinical nurse appointment. It's beyond ridiculous, and I'm not spending 60, 70 quid on petrol or God knows how much on train fare going to London for 5 minutes of my time. So I'm actually going to ask them if they can either postpone that appointment or reschedule it with another appointment that's actually worth driving to. But another thing that baffles me is that when I last seen Dr. Penny Langham, she told me I wouldn't be seeing anyone there now until after I've had my lower surgery. So we're looking at another 2 years down the road before that will be complete. So why I've got this, I don't know. I was going to say there's no date on it of when they sent it. I was thinking if they sent it before I seen her, then fair enough, but no. Oh well, okay, well I guess that covers everything. It's shorter than the rest of the videos, so I know I probably haven't covered much information here. I honestly wasn't sure what to cover when it came to my chest, because once you get to this point, there's not much else to say. It's all healed, it's done, everything looks fine. I don't think I'll be needing a revision. So, yeah, I guess that's it. So, thanks for watching again. Same as always. Check out the rest of my videos if you haven't already. If this is the first one you've watched, hello, and goodbye. So, I'll see you guys in a couple of months probably. I won't be doing a monthly now, okay? Thanks for your ongoing support.